Yeah, thank you. Thank you all for being here as well. And I'd just like to thank the panel and Insu for letting me do this talk. I'd also like to acknowledge some of my co-authors, especially Sean Denny, who's the peer who's actually gone out and done this work that I'm about to present. A bit of a disclosure, this role is funded through NHS England and my role is funded through MSD. So a bit of background. So on this map is Blackpool. If you don't know anything about Blackpool, Blackpool's been described as the Las Vegas of England. So if you can imagine Vegas just without any money or casinos or sun and a few more drugs, then you've got a bit of an idea of what Blackpool's like. So a bit about our peer programme. It actually started 5 years ago in October. It started with just myself and now it's expanded to 7 paid staff as well as our team of amazing volunteers. What we'd noticed was there were areas in the northwest that had a higher proportion of street homelessness compared to other parts of the country, especially Blackpool, which had over double the amount of homeless referrals as well as 3 times the amount of HCV detection. Additionally, it was really common for these patients not to be included in structured drug treatment or have stable accommodation. We also noted similar support needs in other areas of Lancashire, such as Preston and East Lancs. So, a bit of a description about the programme. So we secured the initial funding through NHS England, and that was a 4-month pilot that began in May of last year. We already had a volunteer who had a history of effective engagement and lived experience of HCV as well as homelessness. So what we did was provide him with the skills and tools to work more effectively with homeless communities, but in a paid role. So the peer was provided with phones, vouchers for incentives for testing, as well as comfort packs that included things like hand warmers, bottles of water. So our homeless peer was able to easily identify areas of need and also go outside of traditional testing that we had been doing, so outside of drug services, outside of the homeless services, into the streets. And in order to kind of to record the data that was going on, we hold regular multi-agency meetings to, just to prove the effectiveness of the project. So what is that effectiveness? So since May 2023, we've managed to test well over 1,000 clients. We've managed to see over 800, nearly 800 of those that aren't in structured treatment. 132 of them turn out to be antibody positive, and subsequently 32 have gone on to start treatment. That isn't including those patients that are being directly referred into the homeless project that have been tested elsewhere. That number would be far greater as well. So, conclusions. So it's become clear through the results of the project as well as testimony from Sean's patients that having the lived experience of HCV and homelessness was crucial for patients to feel heard and supported. And this is really seen through the low dropout rate. We have no disengaged patients with this project. We've lost none to follow-up so far. And due to this success, we were able to get another 8-month funding and then a subsequent 12-month funding. And on top of that, we were able to get funding for a second homeless peer support worker who's going to focus more on those coming from a prison setting back into the community that don't have any stable accommodation. And if there's one takeaway that I would ask you guys to take is that the only way to eliminate HCV in our communities is through a peer-led model. Yes, peer-led models bring with it certain challenges, but the rewards of that far outweigh those challenges. So if there was one takeaway, it would be that. So thank you all so much for your time. Cheers.